Welcome to the FIND lecture series. On behalf of the Perinatology Research Branch of NICHD and the National Institutes of Health, my name is Lami Yo, and I am one of the developers of FIND. Before we begin, we encourage you to subscribe to our YouTube channel to learn more about fetal intelligent navigation echocardiography, or FIND, its features, and practical implementation in the clinical setting. More educational presentations will be forthcoming. In 4 different videos of this YouTube series, we are teaching the novel technology known as Virtual Intelligent Sonographer Assistance, or VISA Assistance, which we also call VISA. This is actually one of the most important and essential tools of the FIND method. Therefore, we strongly recommend taking some time to learn about this technology. VISA Assistance, or VISA, are video clips for each of the 9 fetal cardiac views, which function as a virtual sonographer to intelligently assist you in examining the fetal heart. So be sure to take advantage of this feature when performing the FIND method. In Part 1, we introduced VISA Assistance and its objectives, while in Part 2, the 7 benefits of VISA and when to use this tool were discussed. This is now Part 3. We will review the VISA Assistance video clip callouts, or text, that exist for each of the 9 cardiac views. These callouts are written at the top of each VISA video clip. We design the callouts to inform users of the specific purpose or action of the VISA automatic navigational movements. Essentially, the callouts tell you what is happening during the video clip, thereby bringing organization to each video. VISA Assistance is an operator-independent tool that allows automatic sonographic navigation and exploration of surrounding structures in each of the 9 cardiac diagnostic planes. It is essentially a virtual sonographer in the form of video clips for each of the 9 cardiac views. A virtual sonographer would function similarly to an actual sonographer examining the fetal heart during real-time ultrasound examination. As a result, the overall purpose of Virtual Intelligent Sonographer Assistance is to improve the quality of cardiac examination, since the complexity of the fetal heart can be studied in greater detail and specific structures shown. Now, let's discuss the callouts for each VISA Assistance video clip of the 9 fetal cardiac views. First, what are VISA Assistance callouts? As shown by the red arrow, callouts are the text which appear at the top of every VISA Assistance video clip, which is playing on the right side of the screen. The text changes throughout the video clip to coincide with the automatic navigational movement that is occurring. Why were VISA Assistance callouts created? There are 3 main reasons. First, we designed the callouts to describe the specific purpose or action of the VISA automatic navigational movements. For example, the navigation may be specifically showing the right side of the heart. This is shown here where the callout states right heart. Indeed, when compared to the original diagnostic plane image on the left, the VISA image differs because it is emphasizing the right atria and ventricle. The second reason is that since callouts tell you what is happening as the video clip plays, this brings organization to the video clip. Remember, as we discussed in a prior presentation of this YouTube series, VISA navigational movements are never random. We have programmed and organized all automatic movements into a specific sequence to help the sonologist. Therefore, the automatic navigational movements are purposeful, targeted, and intelligent, with the goal of visualizing specific anatomic structures. Finally, every time VISA is activated for a specific cardiac diagnostic plane, the navigational movements are consistent and the same for every fetal case. For example, the 5-chamber view VISA always has 12 program movements. Therefore, the operator can use the callouts to target their navigation. In this example, it was uncertain if the left ventricle was abnormally small, so VISA was activated for the 5-chamber view. Notice that once the VISA video clip is loaded, the operator immediately grabs the scroll button to reach callout number 3, which states left ventricle. It is clear that the size of the left ventricle is actually normal. Let's now provide a brief overview of VISA assistance callouts. How is VISA assistance activated? Here are the 9 cardiac diagnostic planes displayed by Fine for a normal fetal heart. VISA assistance is activated for any of these diagnostic planes by first clicking on the plane and then clicking on the VISA assistance button. In this example, VISA is being activated for the 3 vessels and trachea view, as shown by the thin orange box around this view. Next, the VISA assistance video clip will load, and this is shown by the gray bar. There are always 2 images in the panel. The left image always shows the original diagnostic plane and is labeled at the bottom. In this example, it states 3 vessels and trachea view. The original diagnostic plane image will stay the same throughout the VISA video clip and is shown as a reference. The VISA video clip plays on the right side, and the callouts will always appear at the top of each VISA assistance video clip. In this example, the first callout states tilt caudad because this is the automatic movement that is occurring. The very first frame of each VISA assistance video clip is always indicated by the word start, the name of the cardiac view, and then the word VISA assistance. So in this example, the first frame states start 4-chamber view VISA assistance. Also, the first frame of every VISA video clip is identical to the diagnostic plane image on the left, as shown here. One exception is the vena cava VISA, where this does not occur. During all VISA video clips, automatic navigational movements, which are indicated by their respective callouts, will occur throughout. Once the last VISA frame is reached, the callout will state end, indicating that the video clip is finished playing. The video clip will then automatically replay again from the beginning. This is not shown here. It is important to understand several key points about VISA assistance video clips. First, VISA video clips may provide surprising and unexpected information about fetal anatomical structures, which can help determine if the heart is normal or abnormal. Therefore, we strongly believe that VISA assistance is a valuable and essential tool when performing the Fine method. Here are 2 examples demonstrating this concept. In this fetus, VISA is activated for the abdomen view, in which the stomach is abnormally located on the right side. The assumption is that automatic navigation will occur only through the abdomen. However, VISA actually provides surprising and unexpected information to assist in making the diagnosis. Notice that the liver is midline and located in the left upper quadrant of the abdomen. As VISA navigates into the 4-chamber view, the double vessel sign appears, in which the aorta and dilated azygos vein are visualized posterior to the heart near the spine. The cardiac apex points to the left side of the chest. Finally, as Visa continues to navigate more cranially, the vertical azygos vein is seen draining into the superior vena cava. Putting everything together, this is a case of asplenia and interrupted IVC with azygos vein continuation. This example highlights the fact that Visa video clips are essential in improving the quality of fetal cardiac examination, since the complexity of the fetal heart and surrounding structures can be studied in greater detail. Therefore, we strongly recommend that for a given fetus, in addition to studying all 9 cardiac diagnostic planes, Visa video clips should also be examined carefully. Here is the second example. The 5-chamber view diagnostic plane is shown on the left side and appears normal. However, when Visa is activated, 2 parallel great vessels arising side by side from the ventricles are now automatically shown, which is consistent with complete transposition of the great vessels. If the user had only studied the diagnostic plane shown in the left image, the diagnosis of this critical congenital heart defect would likely have been missed. The second key point is that because Visa video clips may provide surprising and unexpected information about fetal anatomical structures, we strongly recommend watching the entire video clip for a given cardiac diagnostic plane, especially if congenital heart disease is suspected. The third key point is that some Visa assistance callouts are specific in nature, while others are generalized. For example, the callout may only state step 1 or step 2. The reason that some callouts have generalized language is that the action may be a combination of movements or rotations that would be challenging to describe or difficult to understand. But please be assured that even if the callout states step 1, step 2, and so forth, the movements are still purposeful, targeted, and intelligent, and are meant to improve the quality of fetal cardiac examination. This is an example of a specific callout. The 5-chamber Visa callout states right atrium, and accordingly the right atrium is being shown. This differs from the diagnostic plane image on the left side. In contrast, this is an example of a generalized callout. In this Visa of the short axis view of the great vessel's right ventricular outflow tract, the first callout only states step 1, and the image differs from the diagnostic plane image on the left side. The fourth key point is that Visa assistance automatic movements may be informative for one fetus, but may not be for a different fetus. Why? One reason is that among different normal fetal hearts, there is anatomic variation. For example, the same cardiac view, such as the 4-chamber view, will appear different among normal fetuses. Another reason is that fetal positioning and gestational age will differ among fetuses. Therefore, for fetus A, step 2 in the Visa video clip, for example, may be very informative, but may not be for fetus B. So please keep this in mind as you examine Visa video clips among different fetuses. The last key point is that once users gain experience using the Visa assistance tool across different fetuses and various cardiac views, it is easy to learn the callouts and the purpose or action of the automatic navigational movements. Now, let's review all callouts and automatic navigational movements for each of the 9 Visa video clips and provide examples. 3 vessels and trachea view. The total duration of the VISA video clip for this cardiac view is 1 minute, 6 seconds. The goal for this VISA is to automatically demonstrate the 3 vessels and trachea view, 3 vessel view, and transverse aortic arch, as well as the pulmonary valve. There are 3 callouts for this VISA video clip. The first callout is tilt caudad, which shows the 3 vessel view as well as the pulmonary artery bifurcation into the right and left arteries. The 3 vessel view is comprised of the main pulmonary artery, ascending aorta in transverse section, and superior vena cava in transverse section. The second callout states move cephalad and shows the transverse aortic arch. The third and last callout states move caudad, showing the 3 vessel view again. Here is an example of the 3 vessels and trachea view VISA. The first callout states tilt caudad, and at this time the 3 vessel view is being shown, which consists of the main pulmonary artery, the ascending aorta in transverse section, and the superior vena cava in transverse section. Notice that this image of VISA is very different from the diagnostic plane image on the left side. The second callout states move cephalad, and at this time the transverse aortic arch is being shown through VISA. The third callout states move caudad, and during this VISA navigational movement, the 3 vessel view is again being shown. At the end of VISA, the callout states end. 4-chamber view. The total duration of the VISA video clip for this cardiac view is 1 minute, 26 seconds. The goal for this VISA is to automatically demonstrate the left and right sides of the heart, the ventricles, and atria. In addition, the 4-chamber view VISA allows visualization of the pulmonary veins entering the left atrium, as well as the atrial septum primum near the crux and the septum secundum. There are 5 callouts for this VISA video clip. The first callout is move cephalad, which improves the 4-chamber view or shows the 5-chamber view. The second callout states left heart and emphasizes the left side of the heart. In addition, this part of the VISA video clip may show the pulmonary veins and the septum secundum. The third callout states right heart and emphasizes the right side of the heart. The fourth callout states ventricles and emphasizes both ventricles. The fifth and last callout states atria and emphasizes both atria. In addition, this part of the video clip may show the pulmonary veins and the septum secundum. Here is an example of the 4-chamber view VISA. The first callout states move cephalad. For this fetal case, the 5-chamber view is being shown. The second callout, left heart, emphasizes the left side of the heart as compared to the right, and also depicts the pulmonary veins entering the left atrium. The third call out states right heart and emphasizes this side of the heart as compared to the left side. The fourth call out states ventricles and emphasizes both the left and right ventricles. And finally, the last call out states atria and shows the septum secundum nicely with the foramen ovale flapping into the left atrium. Five-chamber view. The total duration of the VISA video clip for this cardiac view is 3 minutes 30 seconds. The goal for this VISA is to demonstrate the aortic root connected to the left ventricle. The anterior wall of the aorta should be in continuity with the ventricular septum, while the posterior wall of the aorta should be in continuity with the mitral valve. The five-chamber view VISA also provides the opportunity to view the mitral and tricuspid valves, the pulmonary veins entering the left atrium, and both parts of the atrial septum, the septum primum and septum secundum. There are 12 callouts for this VISA video clip. The first callout is Move Caudad and shows the four-chamber view along with the atrial septum. The second callout states Return Cephalad and shows the five-chamber view as well as the atrial septum. The third callout states Left Ventricle and emphasizes the left ventricle and the mitral valve. The fourth callout states Right Atrium and emphasizes the right atrium. The fifth callout states Right Ventricle and emphasizes the right ventricle and tricuspid valve. The sixth callout states Left Atrium and emphasizes the left atrium. Previously, the VISA movements targeted each of the four cardiac chambers, but will now target each side of the heart 2 times. Therefore, the seventh callout states Left Heart and emphasizes the left heart and mitral valve. The eighth callout states Right Heart and emphasizes the right heart and tricuspid valve. For the ninth callout, entitled Move Towards Four-Chamber View, a different five-chamber view will automatically be shown by VISA Assistance. The 10th callout states Left Heart and again emphasizes the left heart and mitral valve. The 11th callout states Right Heart and again emphasizes the right heart and tricuspid valve. The final callout, number 12, states Move Towards Five-Chamber View. The five-chamber view is briefly shown before the VISA video clip ends. Here is an example of the five-chamber view VISA. The first callout states Move Caudad and will show the four-chamber view as well as the atrial septum. The second callout states Return Cephalad and will show the five-chamber view with the white arrow pointing to the septum secundum. The third callout states Left Ventricle and will emphasize the left ventricle as well as the mitral valve. Notice the mitral valve leaflets moving in the VISA image as compared to the diagnostic plane image on the left. The fourth callout states Right Atrium and will emphasize the right atrium of the fetal heart. The fifth call out states right ventricle and will emphasize the right ventricle as well as the tricuspid valve. Notice the tricuspid valve leaflets moving in the VISA image as compared to the diagnostic plane image. The sixth call out states left atrium and will emphasize the left atrium of the fetal heart. After this call out, VISA will now emphasize the sides of the heart. Therefore, the seventh call out is left heart and will emphasize both the left atria and ventricle, or the left side of the heart, as well as the mitral valve, which you can see moving nicely here. The eighth call out states right heart, and this time will emphasize the right side of the heart, as well as the tricuspid valve, which you can see moving well here. The ninth call out states move towards 4-chamber view, but will actually show a different 5-chamber view. The 10th call out states left heart, again emphasizing the left side of the heart along with the mitral valve. The 11th call out states right heart and will emphasize the right side of the heart along with the tricuspid valve. And the last call out, number 12, states move towards 5-chamber view and will show the 5-chamber view briefly before the VISA video clip will end. And number 12 call out is shown right here. Left ventricular outflow tract. The total duration of the VISA video clip for this cardiac view is 1 minute 40 seconds. The goal for this VISA is to demonstrate the aorta originating from the morphologic left ventricle. The anterior wall of the aorta should be in continuity with the ventricular septum, while the posterior wall of the aorta should be in continuity with the mitral valve. The mitral valve should move freely, as shown by the red arrow. In addition, the aortic valve should move freely and not be thickened. There are 4 callouts for this VISA video clip. The first callout states Part 1 series of rotations and may improve the left ventricular outflow tract view. The second callout states move towards stomach, and through this action, a different left ventricular outflow tract view will be shown. The third callout states Part 2 series of rotations, and these may also improve the left ventricular outflow tract view. Finally, the last callout states return, and VISA assistance will return to the original left ventricular outflow tract image. Here's an example of the left ventricular outflow tract VISA. The first callout states Part 1 series of rotations and may improve the left ventricular outflow tract. For this specific fetus, since FINE has already obtained an appropriate LVOT through the diagnostic plane, the VISA navigational movements under callout 1 may not necessarily improve the LVOT view. The second call-out states move towards stomach and provides a different LVOT view, and the third call-out states part 2, series of rotations, and may improve the LVOT view. However, for this specific fetus, the navigational movements under call-out 3 may not necessarily improve the LVOT, but may do so for a different fetus. The fourth call-out states return and will return to the original left ventricular outflow tract view before the VISA video clip ends. Short axis view of the great vessels, right ventricular outflow tract. The total duration of the VISA video clip for this cardiac view is 2 minutes 36 seconds. The goal for this VISA is to automatically demonstrate the left atrium and right atrium, tricuspid valve, right ventricle, and main pulmonary artery with its valve. The main pulmonary artery, which bifurcates into the right pulmonary artery and ductus arteriosus, should wrap around the cross-section of the aorta at the level of the aortic valve. The right pulmonary artery courses under the aorta and to the right. Image A is the same image that we just reviewed, with the right pulmonary artery indicated by the red arrow and the left atrium by the white arrow. Now look at image B. Sometimes in the short axis view of the great vessels, depending upon the inclination of the transducer, the right pulmonary artery is more distinct, as shown by the red arrow, and the left atrium is not visible well. Fortunately, VISA assistance also automatically shows image B during the step 4 callout. There are 6 callouts for this VISA video clip and are labeled as step 1 through step 6. Please note that collectively, all these steps consist of automatic navigational movements that are programmed to show the anatomical structures described previously and/or improve the success of obtaining the short axis view of the great vessel's right ventricular outflow tract. The first callout states step 1 and may show the pulmonary artery bifurcation into the right and left arteries. The next 2 callouts are labeled step 2 and step 3 and are generalized in nature. They are designed to show the anatomical structures described previously and/or improve the success of obtaining the short axis view of the great vessel's right ventricular outflow tract. The fourth callout states step 4 and shows a different image of the short axis view of the great vessels, similar to that of image B shown previously. Remember that for image B, the right pulmonary artery is more distinct and the left atrium is not visible well. Step 4 of this VISA video clip may also show the 3-vessel view. The last 2 callouts are labeled step 5 and step 6 and are generalized in nature. They are designed to show the anatomical structures described previously and/or improve the success of obtaining the short axis view of the great vessel's right ventricular outflow tract. Here is an example of VISA for the short axis view of the great vessel's right ventricular outflow tract. Prior to the first callout, VISA will frequently show the ascending aorta, which is located next to the main pulmonary artery. The first call out states step 1 and may show the pulmonary artery bifurcation into the right and left pulmonary arteries. For this specific case, the left pulmonary artery is not seen well. However, the main pulmonary artery bifurcating into the ductus arteriosus and right pulmonary artery are seen nicely. The second call out states step number 2. Here, the right atrium is shown as well as the tricuspid valve. And the right ventricle with the main pulmonary artery and its valve is also seen. The third call out states step number 3, and for this fetus, a very nice view of the short axis of the great vessels is being shown. The fourth call out states step 4, and this is where a different image of the short axis view of the great vessels is shown. The right pulmonary artery is more distinct, and the left atrium is not seen as well. For this call out, this may also show the 3 vessel view with the main pulmonary artery, the cross section of the aorta, and the cross section of the superior vena cava. Again, here is the right pulmonary artery that is more distinct. The fifth call out is step 5, which shows a very nice short axis view of the great vessels. And the sixth call out states step 6. Both the step 5 and step 6 call outs are generalized and are designed to show the anatomical structures described previously and or improve the success of obtaining the short axis view of the great vessels right ventricular outflow tract. Abdomen, stomach. The total duration of the VISA video clip for this view is 32 seconds. The goal for this VISA is to automatically demonstrate the fetal situs and anatomical structures such as the stomach and descending aorta. Therefore, the abdomen stomach VISA has been programmed to show both the fetal abdomen and 4-chamber view to determine the type of fetal situs. The 5-chamber view and 3-vessel view may also be shown. With normal situs solidus, the stomach, cardiac apex, and descending aorta are located on the left side, while the liver and inferior vena cava are on the right side. Situs abnormalities should be suspected when the fetal heart and or stomach are not found on the left side. There are only 2 call-outs for this VISA video clip. The first call-out states move caudad and shows another abdomen-stomach plane caudally. The second call-out states move cephalad and return. During this part of the VISA video clip, the 4-chamber and 5-chamber views are shown, and the 3-vessel view may also be shown. The VISA navigational movements will then automatically return back to the original diagnostic plane image. Here is an example of the abdomen-stomach VISA. The first call-out states move caudad and shows another abdomen-stomach plane. The second call-out states move cephalad and return and shows the 4-chamber view, the 5-chamber view, and may show the 3-vessel view, which it does in this particular fetal case. The VISA navigational movements then return back to the original diagnostic plane. And here one can see that the VISA image is now identical to the diagnostic plane image. Ductal arch. The total duration of the VISA video clip for this cardiac view is 1 minute 57 seconds. Normally, the pulmonary artery continues distally towards the left side and into the ductus arteriosus. The goal for the ductal arch VIS assistance is to demonstrate the right ventricle, pulmonary valve, main pulmonary artery, and ductus arteriosus connecting to the descending aorta, with the ascending aorta located centrally. Remember that both ductal and aortic arches are located very close to each other. However, notice their different appearances. The ductal arch has a hockey stick appearance with a wide curvature, while the aortic arch has a candy cane appearance due to its acute circular curvature. Therefore, when examining the fetal heart in the sagittal planes, it is important to distinguish between the ductal and aortic arches, as shown in the video clip. Fortunately, using the FIND method, both ductal and aortic arches are automatically generated and displayed separately as different cardiac views. In addition, one benefit of the ductal arch VISA is that sometimes the difference between the ductal and aortic arches will be shown automatically during the video clip. In the diagnostic plane image on the left, the white arrow actually points to the transverse portion of the aortic arch and not the true ductal arch. During VISA, the blue arrow points to the true ductal arch, while the white arrow is actually pointing to the transverse portion of the aortic arch. As the video clip continues playing, the ductal arch appears again at the fourth callout, step number 4, as shown here. There are 5 generalized callouts for this VISA video clip and are labeled as step 1 through step 5. Collectively, all of these steps consist of automatic navigational movements that are programmed to show the anatomical structures of the ductal arch and or improve the success of obtaining the ductal arch. In addition, steps 2 and 3 of the ductal arch VISA video clip may also show tricuspid valve movement. Here is an example of the ductal arch VISA assistance. The first callout states step 1. Since the FIND method has already obtained an appropriate ductal arch through the diagnostic plane, the VISA navigational movements may not improve the ductal arch further. The second callout states step 2, and this may show the tricuspid valve movement, which is seen here. The third callout states step 3. Notice that the VISA image on the right is very different from the diagnostic plane image on the left. Step 3 may also show tricuspid valve movement. And you can see this right here. The ductal arch appears nicely in the VISA image. There is a portion of the transverse aortic arch shown. And now the ductal arch is again shown. The fourth callout states step 4. And the fifth callout states step 5. And now we have reached the end of the VISA video clip. Aortic arch. The total duration of the VISA video clip for this cardiac view is 1 minute 4 seconds. The goal for the aortic arch VISA is to demonstrate the ascending aorta, transverse aortic arch, and descending aorta. Remember that the aortic arch gives rise to 3 arterial branches, the brachiocephalic or innominate, left common carotid, and the left subclavian arteries. There are 8 generalized callouts for this VISA video clip and are labeled Step 1 through Step 8. Collectively, all these steps consist of automatic navigational movements that are programmed to show the anatomical structures of the aortic arch and or improve the success of obtaining the aortic arch. In addition, during the aortic arch VISA, the inferior vena cava may also be shown automatically. Here is an example of the aortic arch VISA assistance. The first callout states Step 1. The inferior vena cava is visible. The second callout states Step 2. The third callout states Step 3. The fourth callout states Step 4. The inferior vena cava is also seen here and throughout the VISA video clip. The fifth callout states Step 5. The sixth callout states Step 6. The seventh callout states Step 7. And the eighth callout states Step 8. Remember that automatic navigational movements are programmed to show the anatomical structures of the aortic arch and or improve the success of obtaining the aortic arch. Superior and inferior vena cava. The total duration of the VISA video clip for this cardiac view is 1 minute 36 seconds. The goal for the vena cava VISA is to demonstrate in the right sagittal plane the superior and inferior vena cava entering the posterior aspect of the right atrium. It is noteworthy that we have programmed the vena cava VISA so that the inferior vena cava shown by the red arrow may be viewed multiple times throughout the video clip, appearing and disappearing as the video clip plays. There are 9 generalized callouts for this VISA video clip and are labeled Step 1 through Step 9. Collectively, all of these steps consist of automatic navigational movements that are programmed to show the right atrium and vena cava. Please note that the IVC may be seen multiple times throughout the VISA video clip and may be seen at a specific step which differs among fetuses. For example, the IVC may be seen at Step 5 for fetus A, but at Step 7 for fetus B. So please keep this in mind when examining the vena cava VISA for different fetuses. Finally, the vena cava VISA may show tricuspid valve movement for some cases. Here is an example of the vena cava VISA assistance. The first callout states Step 1. The second callout states Step 2, showing the IVC and the superior vena cava. The third callout states Step 3. Remember that the IVC will appear and disappear throughout the VISA video clip. The fourth callout states Step 4. The fifth callout states Step 5. The sixth callout states Step 6. The seventh callout states Step 7. The eighth callout states Step 8. And the ninth callout states Step 9. In conclusion, these assistance callouts or text describe the specific purpose or action of the automatic navigational movements. Callouts change throughout the video clip to coincide with the automatic navigational movements occurring. Callouts bring organization to the video clip. Callouts can be used to target navigation in the video clip. Key points. These assistance video clips may provide surprising and unexpected information about fetal anatomical structures. We recommend watching the entire video clip, especially if congenital heart disease is suspected. Some callouts are specific in nature, while others are generalized. These assistance automatic movements may be informative for one fetus, but may not be for a different fetus. Please be sure to watch our next presentation on Visa Assistance, where we will teach you how to activate and operate Visa through its buttons and controls. In other words, we will review the knobology of Visa. We will also review very important features of Visa that can be used to enhance the overall fetal cardiac examination, such as bookmarking and double or triple Visa. Thank you for your attention.